So with that being true, based on the published science literature, the fundamental question is how to control and regulate nitric oxide production. Because once we understand this and we understand how to fix it, we can treat, prevent, and cure really any chronic disease based on how nitric oxide works. And there's two pathways to make nitric oxide. The first pathway to be discovered was through an enzyme called nitric oxide synthase. This takes arginine, converts it to nitric oxide. The other is through a dietary intervention where certain foods enriched in nitrate can be metabolized into nitrite, nitric oxide. Stoichiometrically, we know that about 50% of nitric oxide comes from both pathways. One can compensate for the other, but if you have endothelial dysfunction, if you don't get enough nitrate from your diet, or if you're using mouthwash, antacids, and you shut down both of these, then you become completely deficient of nitric oxide, and you're at an increased risk and a slippery slope to cardiovascular disease. And this is the pathway to make nitric oxide from L-arginine. I published this in 2011. And people thought for years, well, I'll just give arginine and get nitric oxide. Well, that couldn't be farther from the truth, because people failed to recognize what's in this blue box here. This is one of the most complicated and complex reactions in the human body. So this enzyme, nitric oxide synthase, converts this guanidino nitrogen here in a 5-electron multi-step oxidation reaction to generate nitric oxide. For this reaction to occur, you need sufficient tetrahydrobiopterin, you need these reduced cofactors, you need oxygen, you need glutathione. And if any of these cofactors become limiting, this enzyme becomes uncoupled, there's a disruption in the flow of electrons, and you generate superoxide and nitric oxide. Interestingly, if you give high-dose L-arginine, you push this reaction to the right and generate superoxide. So giving arginine to a patient with endothelial dysfunction is like putting gas in a car with a blown-up engine. You're not out of fuel, you're not out of gas, you're not out of arginine. The engine to convert it is broken. So in fact, you can do more harm than good. And then we've discovered that once nitric oxide is produced, it can bind to glutathione and form S-nitrosyl glutathione. It oxidizes to nitrite and nitrate, and then we can recycle it. So if you're using arginine or citrulline-based products, save your money. It's not necessary. These are semi-essential amino acids. Your body makes sufficient of these amino acids to fuel this reaction. And this is normally how it works. So if you can appreciate, this would be the lumen of a blood vessel. This is the single layer of endothelial cells. And this is the smooth muscle that surrounds all blood vessels throughout the body. So the best example is when we begin to exercise, this causes shear stress in the lumen of a blood vessel. That tells nitric oxide synthase enzyme, I need nitric oxide, and it turns this enzyme on, converts arginine to nitric oxide, provided this enzyme is functional. And then nitric oxide is a gas. It diffuses in 3 dimensions. So part of it diffuses in the lumen of the blood vessel where it interacts with platelets, monocytes, and neutrophils. Part of it diffuses into this underlying smooth muscle where it activates an enzyme called guanylyl cyclase. That's the enzyme that Dr. Murad had discovered, becomes activated by nitric oxide. And then guanylyl cyclase converts GTP into cyclic GMP. And cyclic GMP is the second messenger that's responsible for the calcium-dependent relaxation. And I'm sure most of you, if not all of you, are familiar with drugs like Viagra, Cialis, and Levitra. These are what's called inhibitors. They prevent the breakdown of cyclic GMP. And we know now with these drugs on the market for many, many years, only 50% of the men that are prescribed Viagra respond with better erections. Why is that? It's because their body doesn't make any nitric oxide here to lead to any appreciable accumulation of cyclic GMP. So erectile dysfunction is a symptom of insufficient nitric oxide production, not a symptom of overactive phosphodiesterase activity. And now we know that you can turn non-responders to PD-5 inhibition therapy into responders by giving them a little bit of bioactive nitric oxide. The problem is the function of this enzyme decreases with age. In fact, we lose about 10 to 12% of our endothelial function with each decade. By the time we're 40 years old, we only have about 50% of the nitric oxide we had when we were younger. This, not coincidentally, is the age that people start to feel the effects of aging. 50% of the men over the age of 40 self-report some degree of erectile dysfunction. 50% of the men don't respond. They start to lose cognitive dysfunction. It's not just men, it's women too. And so the older you get, the less nitric oxide you make through the endothelial nitric oxide synthase pathway. So our thought was, if we can prevent this age-related decline in nitric oxide production, can you prevent age-related disease? And in an hour, I don't have time to go through all the studies, but the answer is yes. So understanding that our endothelial function becomes worse with age, can we start to use nutrition, food, or supplements to provide nitric oxide support to compensate for the loss of endothelial nitric oxide production? And again, we go back to the basics. The air we breathe is 78% nitrogen. This nitrogen is fixed primarily through lightning fixation or by nitrogen fixing bacteria that take ammonia or nitrate. It's added as fertilizers or organic matter. Then any vegetable that we eat that's grown in the soil, we're getting a source of these nitrogen oxides, or any animals that we eat that eats the grass, we're getting a source of these nitrogen oxides. And now, so this is what's called a nitrification process. The human body is a denitrifying process. So when we eat spinach, green leafy vegetables, or get a source of nitrate, this nitrate is taken up in the gut, the proximal gut, the duodenum. And then that nitrate is concentrated in our salivary glands. So then about 90 minutes after we consume a nitrate-rich product or food, it's concentrated in our salivary glands. Then when we salivate, there are nitrate-reducing bacteria that live in the dorsal part of the tongue, the crypts of the tongue, and they convert nitrate to nitrite. So the 2-electron reduction. Humans do not have this enzyme, so we're 100% dependent upon these bacteria. And then when we swallow our own saliva, the pKa of nitrite is 3.4, which means that at pH of below 3.4, 50% of the nitrite becomes protonated, and then we generate nitric oxide gas in the lumen of the stomach. And this nitric oxide that's produced in the stomach from swallowing our own saliva kills H. pylori,